Guys, in this video we'll be talking about the most high yield point you need to revise before NEET PG FMG INI CET. It includes all the triad with must know point and the mnemonic how will you remember it. So guys, let's start with it. And I have sorted in the form like subject wise, like anatomy, biochem. I have gone in this sequence. Hope this helps you guys. So we'll start now. Okay, guys. First of all, is the cauda equina syndrome. We know that spinal cord ends at the level of L1 or L2. Okay, and so this is the level below which we give spinal anesthesia. So what happens in cauda equina syndrome? So basically, this cauda equina looks like the horse tail. So it may be compressed due to a herniated disc, tumor. Okay, so what are the clinical findings of it? So you may remember a rider riding a horse and sitting on a saddle. Means there is a saddle shape of anesthesia, and his butt and other organs are on the horse saddle, so that causes ball and bladder dysfunction and it leads to lower extremity weakness. Okay guys, so we are sorted with this. Now coming on to the Horner syndrome. See, Horner syndrome, what happens? There is the compression of the sympathetic chain. So you have symptoms which you can remember by the mnemonic MAPL or AMPL. Okay, so what happens? M is the meiosis, that is the constriction of the people. A is the anhydrosis, that is loss of sweating. Then P is the ptosis, that is drooping of eyelids. Okay, L is loss of ciliospinal reflex. Okay, and E is exophthalmos. Okay, E is anophthalmos, sorry. Okay, now coming on to the biochemistry, what all things are important. Okay, now coming on to the alkaptonuria. So you know it is a disorder in which there is a deficiency of enzyme homoxanthinic acid oxidase. Okay, so what happens when this enzyme is acid oxidase? So what happens that the urine will turn black on standing. So how can you, this is alka, if you rearrange it, it becomes kala. Kala means black, hence the urine turns black on standing. So what is the triad of alkaptonuria? It is the triad of black colored urine, uchronotic arthritis and uchronotic pigmentation. Okay, now coming on to the pellagra. So pellagra is due to the vitamin B3 deficiency. It is due to B3 deficiency, so it causes D3 symptoms. What is diarrhea, dementia and dermatitis, and ultimately may lead to the death. Okay, now coming on to the vitamin B12 deficiency. Vitamin B12 deficiency, what does it cause? So basically it helps in the maturation of the RBC. So when you have a defective maturation of RBC, so there will be macrovalocyte, means they are they are bigger than normal. The usual size is around 7.2 microns, so it's bigger than that. You will have oval jolly body, so we should revise. Where do we see oval jolly body? We see in post-splenectomy cases and thalassemia cases. Okay, and we will have hypersegmented neutrophil. So what is the criteria of hypersegmented neutrophil? There must be at least more than or equal to 5 neutrophils. Okay, sorry, it's actually more than one neutrophil. It means neutrophil showing more than 5 lobes is known as hypersegmented neutrophil. Now coming on to the other important triads and important points. Acute graft versus host disease. What happens? This is a topic in the rejection of graft. This is very important topic, guys. So what are the features? So you can remember it, graft host disease, GHD. G means gastro symptoms, means abdominal cramps with diarrhea. H means hepato symptoms, means hyperbilirubinemia, and dermato means skin rash. Okay, now coming on to the Alport syndrome. So Alport syndrome, so basically what, this is a disorder of the kidney. Okay, so what happens in Alport syndrome? See, AL, anterior landiconus. P matlab it pees out blood, means patient presents with a symptom of hematuria. Okay, O means ototoxic, it causes sensory neural hearing loss, and T means thickening of the glomerular basement membrane. This is known as the basket weave appearance, which you see in electron microscopy. So this is the typical triad. And what is the problem here? There is a defect in alpha 5 chain of type 4 collagen. Okay, now coming on to the atopy triad. So atopy is what, there is when there is any genetic history to a known cause, it is known as atopy. It is present on chromosome 5. It has 3 A's: atopic dermatitis, asthma and allergic rhinitis. Now coming on to the autoimmune hemolytic anemia. So autoimmune hemolytic, how can you remember it? Remember hemolytic anemia syndrome. H for hyperbilirubinemia, it will present as jaundice. A for anemia, and S for splenomegaly. Now moving on to the next one, Beckwith-Wiedemann syndrome. We know that if you talk about the Wilms tumor, okay, you have three syndrome. Recall guys, what are the three syndrome? First is the Vagar. Vagar means Wilms tumor, aniridia, gentle anomalies, mental retardation. Second is the Beckwith-Wiedemann syndrome, okay, and third is the Danish-Dress syndrome, okay, which shows hemihypertrophy. Okay, so what are the features guys? So macroglosia, see, Beckwith-Wiedemann, what does Wiedemann means? It larger, so so think of mega, okay. M for macroglosia, E for exophthalmos, G for gigantism, because wide, mega, everything is big, okay. Now coming on to the Behçet's disease. So Behçet's disease, what is important? It is linked to HLA-B51, okay. And what happened in Behçet's disease? You have a triad of 3U, uveitis, recurrent oral ulcers, and genital ulcers, okay. And you have a test that is positive. Can you recall guys? It is pathology test. Now coming on to the Dye-George syndrome. Okay, so Dye-George syndrome, what happens? Basically, there is a parathyroid gland hypoplasia and also thymic hypoplasia. Okay, so you remember there is a mnemonic catch-22. Okay, so C stands for cardiac abnormality. A stands for abnormal feces. T stands for thymic hypoplasia. C stands for cleft palate, and H stands for hypoglycemia. And 22 because it's located on chromosome 22q11. Now coming on to the thrombocytopenia. So hemolytic uremic syndrome. So how do you, the classical thing you will find in the history is the presence of the cystocytes. Okay, so thrombocytopenia, T for thrombocytopenia, H for microangiopathic hemolytic anemia known as MAHA, and R for renal insufficiency. Okay. Now moving on to the next one, that is Hinosh-Solnin purpura. So Hinosh-Solnin purpura is very common in pediatric population. So what is the triad? It is purpura, P for palpable purpura, but it is not due to thrombocytopenia, hence non-thrombocytogenic. This is a very important MCQ point. P for pain abdomen and A for arthritis. Now coming on to the Meeks syndrome. So what happens? Meeks syndrome is a triad. So what does come? So you can remember Meeks syndrome is like eating a Maggie. E for effusion, that is pleural effusion. A for ascites, and T for tumor, that is benign ovarian tumor. Okay. Now coming on to the next one, that is Peutz-Jeghers polyp. So Peutz-Jeghers polyp, you know, it is the autosomal dominant condition, and it is caused due to the defect in STK11 gene. And so the most common age of presentation is the age 11 years, that is almost 10 to 14 years. Children are the most commonly affected. So how can you remember it? P is for it, so mucosal pigmentation, you can see guys. J stands for polyps in the jejunum, okay, and D is for dominant. Okay. Now coming on to the virtuous triad. You know, there are some factors which contribute to the thrombosis. So how will you remember it? VI for vessel injury, R is for reduced blood flow, and CH, if you do opposite, it comes hypercoagulability. So these are the factors that contribute to thrombosis. Now coming on to the next one, that is paroxysmal nocturnal hemoglobinuria. Here there is a defect in two enzymes, that is CD55 and CD59. Okay, CD55 is known as decay accelerating factor, and CD59 is known as membrane inhibitor of reactive lysis. So what is the triad? PNH, make out of N make a V. P for pancytopenia, matlab decrease in on the count. V for venous thrombosis, and H for hemolytic anemia. Now coming on to the next one, that is Plummer-Wilson syndrome. So Plummer-Wilson syndrome is an important cause of iron deficiency anemia. Everyone might have read it. So how can you remember it? Remembered die. Okay, D is for dysphagia, E is for esophageal webs, and I is for iron deficiency anemia. Now coming on to the other important triad, that is congenital rubella syndrome. So congenital rubella syndrome, you know, this can happen occur if the mother is rubella positive. Okay, so the triad is CCD. C for congenital heart defect. Okay, then C is for cataracts, and D for deafness. Okay, and most common lesion is the patent ductus arteriosus if we talk about the heart. Okay, and there may be salt and pepper retinopathy due to rubella. Now coming on to the next one, that is congenital toxoplasmosis. We know that plasmosis is caused due to Toxoplasma gondii. It is transmitted due to cat. So there are 3 C's. Okay, chorioretinitis, intracranial calcification, and hydrocephalus. Now coming on to the meningitis. You know, meningitis is the inflammation of the brain. You know that there are 3 meninges: dura mater, arachnoid, and pia mater. When there is meningitis, so what happens? That patient present with fixed headache. So you can remember fever, headache, and nuchal rigidity, that is neck stiffness. Okay. Now coming on to the mycetoma. You know that mycetoma is caused due to actinomycetoma. Okay, so there are 3S. What are sulfur granules, swollen and discharging sinus. Okay, now coming on to the Viscott-Aldrich syndrome. So Viscott-Aldrich syndrome, so you can remember it is like a wasp. Okay, so it is due to wasp gene defect. Okay, means a wasp is running and you are trying to catch it. Okay, so tie the wasp. T is for thrombocytopenia, I is for infection, and E is for eczema. Now coming on to the other important, that is acute anterior uveitis. So acute anterior uveitis, as the name suggests, there is inflammation. So inflammation means redness will be there. So just remember the red photo, like, so it is pain, redness and photophobia. You can remember it as PPR. Okay. Now coming on to the Ritter syndrome. So Ritter syndrome, it is due to chlamydia. You can remember it as write accurately. Okay. So if you write accurately, Ritter is like right. Okay. A is for arthritis, C is for conjunctivitis, and U is for urethritis. Okay. Now coming on to the basal stride. So basal stride is seen in otosclerosis. Okay, so what happens in otosclerosis? If you say basal stride, it's like a buzzing sound that decreases, means everything decreases. Bone conduction is reduced, Raynaud's test is negative, and bone perception is reduced. Okay, now coming on to the important topic, that is epiglottitis. See, if you think about the epiglottitis, the important thing that should come in our mind, okay, is that there is thumb sign on X-ray lateral view. See guys, you can see thumb sign on X-ray lateral view. Okay, and child presents in sniffing dog position. Okay, and see, if you flip like E becomes like 3. Okay, epiglottitis means this is common in the age group of 3 to 6 years, and the treatment of choice is third generation cephalosporin like ceftriaxone. And child presents with 3 features: drooling of saliva, dysphagia, and respiratory distress. Okay. Now coming on to the Grad-Inigo stride. So basically you have 3 Ds here. Okay. Diplopia, discharge, and deep-seated retroorbital pain. Now coming on to the Meniere's disease. Meniere's disease is also known as endolymphatic hydrops. There is either the defective absorption or the secretion of the endolymph. So it can be remembered by the mnemonic WAST. Okay, many like WAST. Okay, V is for vertigo, A is for oral fullness, S is for sensory neural hearing loss, and T is for tinnitus. Now coming on to the Samter stride. We know that Samter stride is seen in aspirin intolerance. So how can you remember it? Samters, if you reverse it, it comes MAS, make it NAS. Nasal polyp, asthma, and aspirin sensitivity. Now coming on to the Trotter stride, it is seen in cases of nasopharyngeal carcinoma. So remember NPC. N is for neuralgia, that is facial. P is for palatal paralysis, and C is for conductive deafness. Now coming on to the other important triad, that is acute cholecystitis. So what happens in acute cholecystitis? Remember 3 T's. There is a tenderness. Where is the tenderness? In the right upper quadrant, because the gallbladder is situated there. Then temperature is increased. And what happens? Total leukocyte count is increased, and there is leukocytosis. Now coming on to the next one, that is amyotrophic lateral sclerosis. So you can remember it that it affected Stephen Hawking. Okay. See, if it affected Stephen Hawking, now how will it help you to remember? A is for atrophy of hands and or weakness of hands and forearm. S is for spasticity of the leg, and H is for hyperreflexia in the absence of any sensory changes. Okay, see, this is a very important quote said by Sir. However difficult life may seem, there is always something you can do and succeed it. So guys, continue trying, work hard in order to achieve what you have desired. So continue working towards it. Now coming on to the aortic stenosis. Okay, like if some person comes to you with aortic stenosis, if you say the patient has a heart problem, he will feel sad. Why did he get it? So you can remember sad. S is for syncope, A is for angina, and D is for dyspnea. Now coming on to the appendicitis. You know that appendicitis, where do you have the pain? At the McBurney's point. And what is the location of the McBurney's point? At the site of medial 2/3 and lateral 1/3 of the inguinal ligament. Okay, so see, sorry, not of the inguinal ligament, between the anterior superior iliac spine and the umbilicus. Okay. See, how can you remember it? Murphy stride. There is pain abdomen, there is puking, that is vomiting, and there is pyrexia. Okay, now coming on to the back stride or the cardiac tamponade. This is very important stride, guys. You need to remember 3 Ds. Heart sounds are decreased, BP is reduced, and the neck veins are distended, which says that it is increased. Okay, now coming on to the Bird-Chiari syndrome. You can remember Bird-Chiari, remember Buddha. Buddha always laughs and preaches that you should always be happy. Okay, so ha 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 ha. So H is for hepatomegaly, A is for ascites, and A is for abdominal pain. Now coming on to the carcinoid syndrome. We know that carcinoid syndrome, it is due to the defect in metabolism of serotonin. Serotonin is also known as 5-hydroxyindole acetic acid. So like what are the features that you see? You will see right heart failure, flushing and diarrhea. Okay. Now coming on to the cholangitis, that is Charcot Stride. So what happened here? Here you will find features of pain, fever, and jaundice. Okay, PPVJ, okay, features. Now coming on to the congestive heart failure, you will find tachycardia, tachypnea, increase in heart rate, increase in and tender hepatomegaly. Okay, now coming on to the Cushing stride. So Cushing stride is very important. Like if a patient comes to you with a stroke and other things, this is very important question. Okay, so it is for raised intracranial tension. What happens if BP reduces in a stroke patient if the heart rate is less? So this is very important. It will cause high BP, systolic, but heart rate will decrease and there would be irregular breathing cycles. Okay. Now coming on to the diabetic ketoacidosis. Okay, as the name indicates, diabetes means increase in blood sugar level. Ketosis, there would be ketone bodies, either ketonemia or ketonuria, which is positive by the Rotheras test. Okay, and acidosis, there will be increase in pH. Okay, so pH will be so there will be increase in pH. Okay, so this tells about everything about the diabetic ketoacidosis. Now coming on to the Dressler syndrome, it is a post myocardial infarction. So this is a complication of MI, this Dressler syndrome. So what do you find in this Dressler syndrome? You have 3 P's. Okay, pyrexia, inflammation of the pericardium known as pericarditis, and pericardial effusion. Okay, now coming on to the Fallty stride. You might have felt that at some places you feel very good, like serine. So S is for splenomegaly, A is for N is for neutropenia, and R is for rheumatoid arthritis. Okay. Now coming on to the Friedreich ataxia. So here also I have talked about some of the trinucleotide repeat disorder that might be asked in the form of MCQ. Okay, so how can you remember it? Okay, Huntington chorea. If you hunt an animal, you will try to put in a case. So CAG is the mutation. Myotonic, T comes, so CTG will be the mutation. Friedreich's ataxia. This ataxia is like a sort of a dance. So like if you are dancing, you will sing along with to Gana Gana. So GAA, and this help you remember GAA is the trinucleotide repeat. Fragile. If you remember, eggs are fragile, it may easily break. So if you take change egg, E can be made to C, EGG, CGG. Okay, and what are the features of Friedreich ataxia? GAA can be made to BAA. Okay, B is for Babinski sign positive, A is for ataxia, and A is for areflexia. Now coming on to the Graves disease. When does Graves disease occur? When the patient has hypothyroidism. So what is the feature? It looks like as if the head is protruding out of a grave. You can remember it. H is for hyperthyroidism, E for exophthalmos, and dermopathy. Okay. Now coming on to the Hakim stride, also known as normal pressure hydrocephalus. Okay, so if you are traveling on a national highway, what do you want? You want the national highway to be good so that it takes less time to travel, and definitely you are paying tax for it, so you are so good. G is for gait disturbance, UI for urinary incompetence, and D for dementia. Okay, guide. National highway also serves as a guide for you to travel. Okay guys, so you can remember like this. Now coming on to the Carter-Jenner syndrome. Car and bus will go hand in hand simultaneously on the road. So B is for bronchiectasis, S is for sinusitis, S is for situs inversus. Means there is the reversal, so dextrocardia may be seen in such cases. Okay, now coming on to the opioid overdose. If you take more of morphine and other things, what happens? The CNS will feel depressed. There would be pinpoint pupil and there will be respiratory depression. So it looks like you are giving CPR. So now you will try to again revive him. So CPR is required. Now Parkinsonism. Remember, like you have parked a car at rest. Okay. So C is for cogwheel rigidity. A is for akinesia or bradykinesia, means decreased movement. Okay. And R is for resting tremor. So how will you remember? Imagine a parked car at rest. It won't move. It has wheels. So cogwheel rigidity. And what is the treatment of choice, guys? Here we give carbidopa plus L-dopa because it prevents the peripheral decarboxylation. Hence, more amount of it reaches the blood-brain barrier. So it's more effective. Now coming on to the pheochromocytoma. Okay, so we know that pheochromocytoma has a tumor. So what are the findings? PHE. Name only suggests palpitation, headache and excessive sweating. Now coming on to the portal hypertension, it is an important topic from the cirrhosis and liver point of view. So how can you remember? Remember a C port. Okay, S is for splenomegaly, E is for esophageal varices, and A is for ascites. Now coming on to the Wernicke's encephalopathy. Okay, this, how does this happen? This is basically due to chronic alcoholism. There is thiamine deficiency. So this can be asked as a MCQ question. And like if you go on a Goa trip, most likely you are to consume alcohol and it's very cheap over there. So how can you remember it? G is for global confusion, O is for ophthalmoplegia, and A is for ataxia. You will be confused after drinking. Okay, ataxia, you won't be able to walk, you will be shaking. Like this photo is represented here like a global ataxia and confused. Now coming on to the preeclampsia. So preeclampsia is one of the problem in hypertensive disorders of pregnancy. So what are the features that will patient? P is for proteinuria, R is for raised BP, okay, and E is for edema. Now coming on to the polycystic ovarian syndrome. We know that there is a criteria known as the Rotterdam's criteria for PCOS. So what does this criteria say you? P is for polycystic, means there are many ovaries, means more than 12 follicles in one ovary. Okay, or if the ovarian volume is more than 10 mm3. Clinical or biochemically, if you find hyperandrogenism symptoms in the patient, okay, and that is oligo-ovulation, means or less ovulation, that is anovulation. So this is the typical Rotterdam's criteria. Now coming on to the next one, that is Wolff-Parkinson-White syndrome. So how can you remember what are the ECG findings? Just remember WPW, which is in the name ECG findings. So W is for wide QRS complex. Okay, P is for in short PR interval, and delta waves are seen. This is very important. Okay, now coming on to the other important revision points in surgery. If you talk about the achalasia cardia, so what happens? The lower esophageal sphincter failed to relax completely. Okay, so what happened? There is incomplete relaxation of the lower esophageal sphincter. There is an increased lower sphincter tone, and there is a peristalsis of the esophagus. Now coming on to the next one, that is biliary atresia. So biliary atresia means there is a defective biliary tree. Okay, so when the tree is defective, how do you like to investigate it? We investigate it with the help of FIDA scan. Okay, so you can remember the findings with the help of FIDA. H is for hepatomegaly, I is for increased conjugated bilirubin, D is for dark colored urine, and pale colored stool, that is echolic or white colored stool. Okay. Now coming on to the brain tumor. If you have a brain tumor, so this tumor will compress the nearby structure. So due to compression, you will have symptoms. What? There is raised intracranial pressure. S is for seizures, and D is for deficit, that is focal neurological deficit. Now coming on to the Delafoy triad. This triad is seen in cases of acute appendicitis. Okay, so how will you remember acute appendicitis? Mac-Burney's point. M is for muscle contraction. Burney's is for burning sensation of the skin, and point is for point tenderness over the Mac-Burney's point. Now coming on to the next one, that is Rigler's triad. So basically this is seen in gallstone problem. Okay, so if you think about the gallstone problem, how can you remember it? G is for gallstones, S is for small bowel obstruction, and P is for pneumobilia, that is air in the biliary tree. If there is blood in the biliary tree, this is known as hemobilia, which is the Sandblom triad, which I will be talking further. Now coming on to the next one, that is gastroesophageal reflux disease. So what happens when you take the food? There is reflux, and there are features of nausea, vomiting. So E is for epigastric pain, R is for retroesternal heartburn. Okay, and there is regurgitation, as I said, guys. Now coming on to the next triad, that is Sandblom triad. So Sandblom triad, hemobilia. So what happens in hemobilia? MOB. M is for melena, because there is blood, so there will be dark colored stool. Okay, obstructive jaundice and biliary pain, biliary colic. Now coming on to the next one, induced susception. So induced susception is a type of intestinal obstruction, guys, in which one segment of the intestine telescopes into the other segment. So you have a classical triad which you can remember by PEPR: pain, abdomen, palpable mass, and red currant jelly stool. Okay, if someone asks you, where do you find red currant jelly sputum? So that is actually Klebsiella. Okay, this can be asked as a MCQ. Now coming on to the next one, that is Macular triad. So Macular triad, where do you see? It is seen in Bohr-Haft syndrome. So how do you remember it? Just go in a reverse direction. Okay, SE is for subcutaneous emphysema, V is for vomiting, and A is that is pain, chest pain. Now coming on to the saints triad, you can the saints, they are compared to sadhu. So how will you remember it? S is for stones in gallbladder, D is for diverticulosis, H is for hiatal hernia. Okay. Now coming on to the trauma of death. Okay, so trauma is death means in unstable patient, what are the factors that cause high mortality? So if the patient is cold, that is hypothermia, coagulopathy, some blood disorders, and if he has gone into metabolic acidosis. Now coming on to the Whipple's triad. This is important from MCQ aspect. This is seen in insulinoma. So what do you see in insulinoma? There is elevation of symptoms if you give IV glucose. Symptoms of hypoglycemia will be there, guys, and plasma glucose is lesser. Okay. Now see, all the combination that we have read that we often get confused, I'll summarize it. Now think Charcot's triad seen in cholangitis. What we have read? Pain, fever and jaundice. Now coming on to the appendicitis. Okay. Appendicitis we have read Murphy's triad. So Murphy's triad we read 3P. What were the 3P? That was pyrexia, pain abdomen, and we have puke, that is vomiting. Okay. Now coming on to the choledochal cyst. Okay. So choledochal cyst looks like it has a mass. So there will be pain, there will be abdominal mass, and there will be jaundice. Now coming on to the next three things that we often get confused. That is renal cell cancer versus renal vein thrombosis versus nephroblastoma. Okay, so this nephroblastoma is also known as Wilms tumor. Okay, so how will you remember it? Wilms tumor is seen in child. I said the 3 syndrome, revise it, guys. So hematuria, mass, and pyrexia is there. In renal cell cancer, there is hematuria and mass, but instead of pyrexia, there is pain. And if we talk about the renal vein thrombosis, you have low platelet, that is thrombocytopenia. So hematuria and mass are common in all of them. But the third characteristic in all the triad differ, guys. So think about this when you are revise it once, guys. Now coming on to the other thing, that is in dermat, we talk about the acrodermatitis enteropathica. This is due to the deficiency of zinc. And which gene is mutation? SLC39A for gene problem is there. Okay. So what is the triad? A for alopecia, D for dermatitis, E for enteritis, means inflammation of the intestine that causes diarrhea. Now coming on to the albinism. So albinism, you can remember that there is deficiency of the enzyme tyrosinase. So as a result, body is depigmented or hypopigmented. So if the body is depigmented, B is for black locks, O is for oculocutaneous albinism, and D is for sensorineural deafness. Okay. Now coming on to the next one, that what is the triad of anesthesia? If you give a patient anesthetic, what happens? If he becomes silent and sleep. Silent is equal to moan, okay, that he is keeping quiet. So M is for muscle relaxation, A is for analgesia, that is decreased pain, and UN for unconsciousness. Now coming on to the Bizold-Jaris reflex. Okay, so this reflex you can remember BC, CD, DB. BC for bradycardia, CD for coronary dilation, and DB for decreased BP. Now coming on to the other important things from the pediatric aspect, must know things. Okay, so there is a syndrome known as Aicardi syndrome. How will you remember it? CA is for corpus callosum agenesis. Okay. Then see, RD is for retinal defect. Okay, means see, there are circumscribed pits or lacuna, and I is for infantile spasm. Okay, and what sign will you see? There is a car, so it will race on the track. That is racing car sign is seen in CT. Okay, see guys, you can see it looks like a car. You see, if you see, that looks in the CT. Okay, and also this racing car, they are resistant to anticonvulsant, means like you can remember, they do not stop by speed breaker. Here the speed breakers are anticonvulsant. Okay. Now coming on to the other important triad that we have read and just we are revising. Okay, Behçet's disease, remember 3 U's. What were? Recurrent oral ulcers, then you have uveitis, and then you have genital ulcer. Now coming on to the triad of congenital syphilis, which is also known as Hutchinson triad. Okay, so what are the important things here? You see interstitial keratitis, Hutchinson teeth, and deafness. Okay, Alport syndrome we have already talked about. Then coming on to the triad of osteogenesis imperfecta. This is also known as Van der Hulst triad. So you have blue color sclera, you have fragile bones, and deafness is present. Okay. Now coming on to the cystic fibrosis. You know cystic fibrosis is a defect in CFTR gene. that is cystic fibrosis transmembrane regulator gene located at the delta F508 position. Okay guys, so what happens? So you can remember it as cystic fibrosis manifest as. C is for chronic sinopulmonary infection, F is for failure to thrive, and M is for malabsorption. Now coming on to the next one, that is dandy walker syndrome. So say dandy walker, if you remember Gandhiji walking with a dandy, he took the dandy march. Okay, so how can you remember it guys? See, so you can think about the dandy march. So D4 dandy is for dilated fourth ventricle. Okay, N is for non-communicating hydrocephalus. Okay, DY is for dysplasia or hyperplasia of the cerebellar vermis. Okay, walker means he needs a walker to walk because he has cerebellar ataxia, so he cannot walk without a. And Mahatma Gandhi, there is atresia of foramen of Magendie. Okay, so you can remember this guys, it's very easy now. Now coming on to the hemochromatosis. So what happens that there is deposition of more of copper, so there is bronze colored skin, there will be cirrhosis of liver, and there is diabetes mellitus. You can remember that BCD. So bronze skin will cause hyperpigmentation, cirrhosis of liver will cause liver damage, and diabetes will cause damage to the pancreas. Now coming on to the Klippel-Feil syndrome. So what happens in Klippel-Feil syndrome? It looks like a triad of, you can remember, like there is short neck. Okay, so there is short neck, there is low posterior hairline. Okay, and there is limited range of neck motion. Okay, you can easily remember with this guys like a clip. Okay, now coming on to the Kwashiorkor. You know that Kwashiorkor and marasmus are two types of protein allergy malnutrition. Remember PEM and GEMS rounds. So what are the triad? G is for growth retardation, E is for edema, and M is for mental change. Right? Don't confuse between Kwashiorkor and marasmus. How will you not confuse guys? See, like whether it is a triad of Kwashiorkor or marasmus. See, Kwashiorkor has O, that is edema, while marasmus does not have any edema guys. So like no need to confuse, this is a triad of Kwashiorkor and not marasmus. Now coming on to the measles. Okay, measles is caused by paramyxoviridae, you guys know this, and there is a triad of typical 3C, that is cough, coryza, and conjunctivitis guys. Now think about the guys, measles vaccine, when do we give? I talked about in one of the video. First dose of measles rubella is given at PJMA, that is 9 to 12 month, and second dose of measles rubella is given at guys 16 to 24 month guys. If you don't remember it guys, if you find it difficult, please go and check my previous video where I have given extremely easy mnemonic so that you cannot forget national immunization schedule anymore now guys. Now coming on to the necrotizing enterocolitis. See, you know that necrotizing enterocolitis is a pediatric emergency guys. So this is a pediatric emergency and the staging is known as Bell's staging. So just remember, like, who will tie a bell, okay, on the neck of the rat. Okay, see, rat is the biochemical triad. R is for refractory hyponatremia, A is for acidosis metabolic, and T is for thrombocytopenia. Okay, now coming on to the Vox triad. This Vox triad is also known as epiloa. Okay, Vox triad is seen in tuberous sclerosis. For tuberous sclerosis, we have two genes, that is TSC1 and TSC2. Okay, TSC1 is located on chromosome 9 and TSC2 is located on chromosome 16 guys. So epiloa, EPI is for epilepsy, LO for low intelligence. Okay, A is for adenoma sebaceum that you see in the face. Okay, please guys, I hope you are done with this. If you like it guys, please follow, comment, subscribe for more such high content, amazing content. Thank you guys.